morning, everyone. Good morning, Queensland. So overnight I can report that there have been 3 new cases. We're not worried about them. 2 were acquired overseas and are in hotel quarantine, and none of them are from the guests at the Grand Chancellor. And there is 1 case that has been reported in Cairns, but that is a historical case, so we have no concerns about those 3 today. So we have 30 active cases, 1,290 total cases, and in the past 24 hours we've had 10,820 people get tested. So once again, this is great work. And can I just remind Queenslanders, if you have any symptoms, of course, please go and get tested. Now, in relation to the Grand Chancellor group, the 129 that were transferred, I have been advised that all have tested negative. So that's good news, because that was our high-risk group that we were looking at. The 147 people who left since the 30th of December, the ones that were in Queensland have all been tested and have tested negative. So once again, good news. And of the 226 staff, all have been contacted, and some of them have been tested. So we're still working through that. But out of the 502 in total, the Queenslanders have been contacted and the vast majority are negative. So we're very happy with that. So look, I hand over to Dr. Young. The only thing I wanted to say in relation to, we addressed looking at alternative forms of accommodation. I just want to update everyone that these investigations will continue about looking at different options. And as I said, that I will be discussing this at National Cabinet on Friday week. Please give me the opportunity to speak to my federal counterparts. And of course, this is a proposal that we are looking at. And of course, there needs to be a lot of work that's done there. But I think we need to have these options on the table, because as we know, there's a lot of this UK strain circulating at the moment in UK and parts of the Northern Hemisphere, and we do need to make sure that we have the best lines of defence here in Queensland to combat this virus. So with those few words, I'll hand over to Dr. Young.
So 3 new cases overnight. The first case is a gentleman in his 60s who's in hotel quarantine in Brisbane, and he travelled here from the Philippines, so he's acquired it there. The second case is a gentleman in his 40s who travelled to us from the United States, and he's in hotel quarantine, tested positive. The third is a gentleman in his 40s who returned from the Congo in September, and he was in hotel quarantine then, tested negative, but he had to have a test done prior to returning to work, so an employment requirement, and he's tested positive. He's totally well, asymptomatic, so we think that is most likely a persistent shedding. We know you can shed for up to 9 months after you're positive, and it probably explains why we've continued to have all of those positive sewage results in North Cairns. If you remember, we've had quite a few of those and we've not been able to explain them. He lives in North Cairns. So that's the most likely explanation there. So now, of course, we're going to do some additional testing just to confirm all that, but I'm very confident that that will be a historical case and not infectious at the moment. So that's good. So we've then followed up the vast majority of all of the people related to the Grand Chancellor, all of those guests who were moved, all of the staff, all of the guests who've left before we found out about this issue. So I'm becoming more and more confident that there is no ongoing spread as related to that. So we're going to do some further work over the next 24 hours, and police will continue their investigation, of course, and we'll be able to work out what we need to do going forward related to that hotel. So that's all going very, very well. Plus, we've had a lot of support from the community coming forward to be tested from that area in South Brisbane, round that Logan area and so forth. due to those 2 cases having been in the community, and I'm getting increasingly comfortable, very comfortable, that we've not had community spread there. And I just commend everyone for what they've done. As soon as we knew we might have an issue in terms of that 3-day lockdown, it's so reassuring that we can use that if we ever need to again, because people were just brilliant at how they responded. And thank you to everyone for using the masks, because I think that really makes a big difference, and people have been fantastic doing that. So thank you very much.
Well, very good news overnight. Every day we are getting closer to that 1 a.m. Friday the 22nd of January lifting of restrictions. So we're really pleased that over the last 24 hours we continue to see negative test results for all these people who have been close contacts and contacts associated with the Grand Chancellor and the cleaner and her partner. So I want to thank Queenslanders, thank those people from Greater Brisbane, and simply ask Queenslanders and people visiting Queensland to continue to be tested. If you have any symptoms whatsoever, of course we want to make sure that we are keeping our testing rates high. So please, any symptoms whatsoever, come out, get tested and stay home until you get those test results. This is how we can make sure that our community stays safe, and we all look forward to the 22nd of January to be able to see those restrictions lift if the results continue to be as positive as we have seen up to date. Thank you.
Good morning, everyone. As you know, the Queensland Police Service have the lead in a joint investigation with Queensland Health to determine how the cluster occurred, obviously, in Hotel Grand Chancellor. We have well and truly started this investigation, and I ask you to be patient because there is a fair way to go still. It's a lengthy process, and we will make sure, obviously, that we interrogate every aspect of what has occurred in that hotel. Environmental swabbing of the hotel has been completed, and this is literally where swabs are taken off the service area where staff work, the walls, materials in the hotel, etc. And this will be subjected to extensive testing by Queensland Health. Interviews have taken place of 3 of the 6 infected people, and this isn't straightforward. As you can appreciate, some of these people are sick in hospitals, so their health and well-being must obviously be considered in context of the overall investigation. Ongoing inquiries will be conducted obviously with the Queensland Police and the ADF, and also investigation priorities will continue with the remaining infected people, other cleaners, hotel manager, occupants of other rooms, and also any other cleaning staff. Can I thank the staff at Hotel Chancellor? They've been absolutely brilliant in their cooperation in terms of this investigation. Other aspects of the investigation which we'll be looking at, and incredibly important, policies, procedures, protocols and training in terms of what occurred in that hotel. This will be combined with infection analysis by Queensland Health to compile a list of joint recommendations. So not only finding out what occurred in this instance, but also joint recommendations relevant to the entire hotel quarantine program. The issue identified so far in terms of CCTV, that hotel did have CCTV in many aspects of the hotel, but not on that floor. And whilst I think we were quite satisfied when we have done many reviews of our quarantine procedures, so what we have is CCTV in many parts of the hotel, and police and other staff conduct very, very comprehensive patrols of all the floors. I've asked a full audit of all hotel quarantine hotels in terms of their CCTV footage. And what we will do is, if we find that there is any gap in that whole process, that we ourselves make sure that we put CCTV footage into those hotels. And that has already commenced in 2 of the hotels. So the other thing I wanted to touch on, yesterday there was an issue raised that a father and a daughter, there may have been a potential breach of quarantine on the 11th of January, and this was reported quite extensively yesterday. I can tell you from extensive independent inquiries that the daughter was wearing full PPE at all times. She was transported by QAS, not a taxi or Uber, from the hospital back to the hotel, and was then escorted by 2 police officers back to her room. So please, if you hear anything about that, just make sure that we do get the right story out there. I'll leave it at that, and I'll just obviously wait for more questions from the floor. Thank you, Premier.
Commissioner, on that, first before you leave, in regards to that potential breach, regardless of if anything wrong was done, as you say, nothing wrong was done. This is of public interest, I would argue, given that we are looking at how this spread within the hotel.
Yeah.
Any movement of anybody who has since tested positive, do you think the public should have been told that this person has left the hotel, or most people have left the hotel? I would have thought that we should have been told that, especially given the amount of press conferences we've had this week.
Okay, so I'll leave that to Jeanette. The only reason being is because I would think that there's transports often to hospitals and QAS are always involved. So I'll leave that question specifically to health, but this is not a one-off. So, and it's always done within the proper protocols that occur within quarantine hotels.
So who made the call to let that daughter accompany the father? Whose call was that?
Jeanette will answer that because I've got the brief from her this morning, so I'll let her answer it. But definitely I understand, because the father, in terms of his English fluency, it was best to have the daughter travel with him. So that was determined, I'd say, by health. But I'd let Jeanette answer that, and I'll come back for more questions if you want.
We have over 3,000 people in hotel quarantine, and a number of them are frail and do have other health conditions. So it's not unexpected that people leave the hotels to access healthcare. That's been going on for a long time. Of course it has. And we have always required them to leave in an ambulance wearing PPE. So they are treated as if they're positive. So when they get to the hospital treats them as if they're positive, works through what's wrong, and then if they're well enough, they go back to the quarantine hotel. If they're not, they stay. So that happened with that gentleman. So he was taken there because he had some health issues, which were probably early symptoms of his COVID in retrospect. So we didn't get a positive result on him till the next day. But it doesn't matter, because he went via ambulance to the hospital, was assessed there, was treated as if he was positive, was kept because he needed to for the symptoms that he had. Now, his English is not great, so the daughter went with him, but she was treated as if she was positive. So they were managed in negative pressure rooms, etc., etc. So there's no risk. And all of the transport was done via QAS. And that is QAS's job, and they do it very, very effectively. They move infectious people, not just COVID, but other infectious people. So there's no issue here at all. The hospital asked that the daughter go with the father because of his lack of English.
How common is it for people to accompany loved ones to hospital and leave hotel quarantine?
Well, it depends on the situation. But if it's a child, for instance, yes, a parent would go with them. If it's someone who English is not their first language and they have problems communicating. But the important thing to recognise is that whoever goes is treated as if they're positive. So it's not an issue from my point of view. We've been getting more and more positives in hotel quarantine. All of those get moved immediately to hospital, as has occurred with our 2 new cases in hotel quarantine today in Brisbane.
Regardless of if it's an issue though, as a member of the public, do you think the public should have been told that someone who's later tested positive with a strain that we're treating so seriously had left hotel quarantine, gone to hospital and gone back? Regardless of if it's an issue, do you think the public had a
No,
right?
I don't think so, because this is what we do every single day. We move people out of hotel quarantine to hospitals and have them assessed. And we've had other cases where people have then been found to be positive. That's what we do, and we always do the contact tracing as well as an additional precaution. So we immediately, when we knew that that lady was positive and infectious, when she went to the hospital, checked, and the hospital said, yes, we treated her as if she was positive. There's no concern. That's why we have a hotel quarantine program, and that's why I've always, as you all know, been very reluctant to let people leave that program. So we've, over the months that's been going, we've gradually tightened it up more and more and more. You would have seen initially we allowed fresh air breaks. We don't allow them now. Initially we allowed people to go out and visit sick relatives. We don't now. There's all of those things that have happened over the last year.
Dr. Young, New South Wales government has said putting quarantine facilities out into the regions is against public health advice from New South Wales. What's your view on that?
New South Wales is a different state to Queensland. They'll have different issues. They'll have different abilities to respond. They need to make their decisions in the best interest of their people, depending how they can manage. And we will make decisions here that the Premier will take in the best interests of Queenslanders. But we've just got to remember, every state has different situations and they've got to deal with the situation of their state.
Good morning, everybody. Pleasingly, we have another day of zero community transmission in New South Wales. However, our testing rates are not where we would like them to be. We had just over 16,000 people come forward to get tested in the last 24 hours. I do want to thank the community for the response to the most recent outbreaks. It's demonstrated that when we all work together, when we work and rely on the health advice, that we can actually keep the community safe, but also make sure that we're providing our citizens with as much opportunity to have a normal life as possible. I want to thank everybody for really respecting the restrictions, respecting the health advice we've provided, and it's allowed us to be in this position. Now, the government is very much in the space of considering health advice in relation to easing restrictions, and I want to make that clear. But we won't have the confidence to do that unless we have high rates of testing, because that will assure us that we have captured all previously undetected cases of the virus which may still be infectious in the community. So we really need that level of confidence by having high rates of testing to allow us to ease restrictions. But I do want to say to the community of New South Wales, in particular to Greater Sydney, that we are very much in the next few days considering what restrictions we can ease, but that will depend on obviously having low case numbers and also having higher rates of testing. So we are really pleading with the community, please come forward and get tested if you have the mildest of symptoms. That will allow us to have the confidence to bring in the easing of restrictions, and particular things we're looking at are obviously children under 12 being allowed in households, potentially looking at weddings and what we can do there. I know how stressful it is. We all know how stressful it is for people who are having those milestone events, and clearly what extent mask wearing becomes part of our response moving forward. So these are the type of issues we're looking at now, but we won't have the confidence to move forward and have those easing until we get those high rates of testing. But we are on the right path, and I do want to thank everybody in the state, especially in Greater Sydney, especially in the Northern Beaches. We're doing all the right things because it has made a real difference. And I want to especially thank the health contact tracers, our health experts, because their advice has been absolutely precise in allowing the government to move forward and getting the results we have to date. And I know that this time of year was extremely stressful for all of us in dealing with these issues, no less stressful for the government when we're considering about what we did over those milestone events of Christmas and New Year's. But to date, we know the response has been overwhelmingly positive from the community. We're deeply grateful, and please know that top of mind for us is making life easier for everybody, for being able to ease those restrictions where we can, and providing certainty to business, which is really important as well. The feedback we have obviously is that we want to provide as much certainty as possible. And as far as New South Wales is concerned, our position on borders remains as strong as possible. Our position on how we manage our outbreaks remains as strong as possible. We want to make sure health and safety always comes first, but of course, mental health, well-being and keeping jobs and the economy moving forward are also really critical, and it's this balanced strategy that will continue. And again, I don't mind what criticism we get from others. We feel very strongly that New South Wales strategy to date has proven to be the best one for our citizens, and we will continue on that path. I'll now ask Dr. Chant to provide more details around the health situation, and of course then we'll take questions. Thank you.
Thank you, Premier. So New South Wales recorded no locally acquired cases in the 24 hours to 8 p.m. last night. There were 2 cases of acquired in overseas returned travellers. So this brings the total number of cases to 4,856, and there were 16,070 tests performed, which was down on the previous day's testing. Can I echo the Premier's call for testing? It is a plea to the community to please come out for testing, regardless how minimal those symptoms. Don't delay, get a test. And I'm urging every family to prompt their loved ones to come forward for testing and not delay. It is critical at this time in the response that we mop up any transmission chains, but also I would also urge you to go about practicing those COVID-safe practices. So do not become complacent as we indicate no cases of community-acquired infection. It is important because if there are any remnant viruses transmitting in the community, your actions by maintaining that physical distancing, wearing those masks in the settings where we've asked you to, getting a COVID-safe test and practicing good hand hygiene and following the rules around how many visitors to your home will all help us prevent chains of transmission establishing in the community. We also overnight had the sewage detection in people living in Sydney's northwest are being asked to be particularly vigilant. Now, whilst this could reflect cases in the catchment that are known in terms of returned travellers, anyone living in Glenorrey, Wahroonga, Thornley, Pennant Hills, Cherrybrook, Castle Hill, Galston, Dural, Westley, Glenhaven, Waitara, Hornsby, Normanhurst and West Pennant Hills should monitor for symptoms and get tested. Also, our testing focus is statewide, but particularly urging those residents of Greater Western Sydney, so those areas of southwestern and western Sydney, to be particularly prompt in coming forward for testing with the most minimal of symptoms. Thank you.
Questions?
Firstly, Premier, if I may, the restrictions you mentioned, so the ones that you are focused on getting to, you mentioned weddings. What type of restrictions are you looking at, and how many new numbers on tests would you be looking at?
Look, I didn't really want to specify the range of restrictions that we're looking at, but the ones that I've given are just examples of. We want to provide certainty for the community, certainty for business, so we would much rather have a holistic step change in restrictions rather than doing little bits and pieces here and there. So we are looking at a whole range of things, but that will depend very much on 2 factors. Firstly, the case numbers, but also obviously the testing rates. And it doesn't mean you have to have 0 every day for weeks on end. But what it does mean is that our health experts have confidence that there aren't undetected chains of transmission still bubbling along in the community. And that's what we're always worried about. We're worried about somebody not knowing they've got the virus, going to a particular venue and unintentionally spreading it to a large number of people. And that's what we saw happen, notwithstanding everybody was doing the right thing, but that's what we saw happen in Avalon. And we don't want to see that again, because we know the current strains of the virus are more contagious. And we know now that most people who get the virus, even in quarantine, will have those more contagious strains, and that does put additional question marks for us in how and when we ease restrictions and how we do that. So I do want to stress to the community that relief is on its way, so long as we maintain low or 0 numbers of cases on a daily basis, and also so long as we get those testing rates high, because that will give the health experts confidence that those low number of cases or 0 number of cases are working hand in hand with high rates of testing, and that's the perfect combination that will allow us to move forward. But I am anticipating, hopefully in the next week, being able to make announcements to give business and community that confidence that we are easing restrictions, because our policy from the outset has been we don't want to have a single day where we burden our citizens more than we need to in any area of combating COVID. And that certainly applies now. And I appreciate that after a couple of days of zeros, the community will start thinking, well, can't we ease restrictions yet? And our response is we are definitely in that space, but we just need a few more days, and we also need those testing rates to go higher to give us the confidence that we can do that, because the last thing we want is to suddenly ease restrictions and then go back to where we were a few weeks ago. So we just need to be confident that we've really clamped down on all those undetected strains.
We did hear from you yesterday that there was a proposal from the Queensland government to perhaps move hotel quarantine to regional areas. What are your thoughts on that?
Look, I support the comments made by Minister Hazzard yesterday. I don't think that would be a good idea. That would raise a whole level of other complicated issues. We need police, health staff, federal authorities, ADF to all participate in the quarantine system. And all you'd be doing is simply moving those challenges somewhere else, perhaps with greater difficulty. We know that virus spreads more readily in transporting people. When you have people travelling for long periods of time, you're more likely to spread the virus than whether the trips are shorter. So all you would be doing is moving the challenges to a different location. The challenge is already there, and staff always have to go home to their loved ones. So we believe what we need to do is make sure we have the tightest quarantine system we have. The New South Wales system has proven to be effective to date. But as I've always said, you can't guarantee that 100% of the time, 100% of people intentionally or unintentionally doing the right thing. But having said that, if there's opportunities for us to tighten things, to make things stricter and better, of course we will. And that's why the pause in the number of people we're welcoming back, the number of Australians we're welcoming back, is a good opportunity for us to firstly understand a bit better what the new strains of the virus are doing, and also to understand what that means for our overall settings and what it means for the quarantine system. For example, if we know the new strains of the virus are far more transmissible, far more contagious, that would mean in all likelihood that if one person in the household had the virus, the chances of them spreading it to other people in the household is higher. If one person in a particular place has the virus, that the chances of them spreading it to others in that vicinity is higher. So they're the factors we need to consider whilst we have that pause, and I think it's an important thing to do.
In that context, what would you say to other state and territory leaders in regards to the borders?
Look, I think New South Wales has demonstrated our capacity to be able to deal with outbreaks when they occur. And I use the word when because it would be unrealistic for us to suggest we're not going to have another outbreak before the end of the pandemic. And what we need to think about is we don't know how long this pandemic's going to last. We know the vaccine will start to be rolled out later this year, but we still know it'll be several months before a substantial proportion of the population have access to it. So whilst we're dealing with the pandemic, we have to think about, well, how can we keep our citizens mentally well? How can we make sure they're able to move around, conduct business? And therefore, we need to think about how we approach borders. And I think too many state leaders are moving too quickly in closing their borders without properly assessing what it might mean for their citizens and what it might mean for others around the nation. And we are all Australian, yes, we're all members of a state, but if you have confidence in your state's ability to get on top of an outbreak, well then you should think a bit carefully about when you need to move on borders. And look, I appreciate if the Avalon cluster had occurred in another state, we definitely would have put measures in place in relation to Avalon or that region, but we wouldn't have shut down the whole state, or we wouldn't have said to every single person in Australia, you're not welcome to New South Wales. I mean, I think we need a balanced approach. I think we need an approach which affects as few people as possible. And we also need to demonstrate confidence in our system and also confidence in the community to be able to follow the advice we're providing. I know it's scary at times. I mean, I've been, and our government's been in situations where making decisions around those issues is scary, but you have to think about the well-being of the majority of your citizens and how that can impact. And when I say majority of citizens, of course, as the Government of New South Wales, we care about our citizens, but we also care about citizens in other states who are also going through those difficult times and trying to exhibit compassion as Australians.
What was scary at the moment, Sonia?
I'm sorry?
What was scary? You talk about scary. What
Oh, look, there's a number of decisions that are always scary in a pandemic, but when you've learnt from experience and you appreciate the health advice being provided, you always have to balance up, well, what is in the best interest of keeping the virus at bay, but also in providing a sufficient amount of normality for our citizens. And so it's always a difficult decision. I think one of the most difficult decisions was when the state went into lockdown last year. Another very difficult decision was closing the Victorian border, because we knew what impact that would have on hundreds of thousands or tens of thousands of people. And that was a really difficult decision. But I believe we've made all those decisions at the right time, and we've made them with the motivation of trying to impact as fewer people as possible whilst keeping the virus at bay. And these difficult decisions are going to get even more difficult this year, because whilst you're having a vaccine rollout, you still need to keep the community safe. So that level of decision making won't change. But I think what's important is for us to continually have a conversation with the citizens of our state that our strategy is, as much as possible, first and foremost, keeping them healthy and safe, but also making sure that we think about their wellbeing, think about the economy, think about jobs, and thinking about where New South Wales will be during and post-COVID.
Two police officers have been assaulted at a shopping centre while asking shoppers to put masks on. Firstly, what's your reaction to that? And secondly, obviously police have been quite lenient. They've handed out about 350 warnings for mask wearing. Is it now time for more of a crackdown, or as you hinted, are we likely to see the easing of mask restrictions?
Well, firstly, we can't thank the police enough for the role they've had in compliance issues around New South Wales, whether it's managing hotel quarantine, whether it's supporting the health advice and making sure our citizens are doing the right thing. Can I stress that the vast majority of people are doing the right thing and respecting the restrictions, but it's so disappointing when disrespect is shown, or worse, to police officers or anybody else working in the system to keep all of us safe. Yes, I know it's difficult and uncomfortable. There are things that I don't like to do, but we're all doing it to keep each other safe, and that's what's really important. But as I said, the community can look forward to the easing of restrictions so long as we see the current cases continue in the way they are, and so long as we increase those testing rates, which will give our health experts that extra degree of confidence for us to be able to move forward. Please know, and I can't say this enough, that we don't want to burden our citizens a day longer than we need to, but we also have to respect the health advice. Not doing so can put all of us in jeopardy, and that's certainly not a situation we want to face. I'll come back to this side, yep. Oh, look, there's no doubt that there's a huge economic cost to border shutdowns, and that, of course, weighs heavily on my mind, but there's also huge human cost. It's heartbreaking to hear about families being separated, heartbreaking to hear about parents and children living, 20 or 30 kilometres apart but not being able to see each other because they happen to live on either sides of a border. So we need to think about the economic cost but also the human cost of those border issues, and both of those play on my mind. And I think we also need to have greater consultation and conversation with each other before those border decisions are made. It's not simply enough to communicate through whatever channel that a border is being closed. It's more important to communicate what we think is going to happen with a particular cluster, what we're doing about it. And also I just ask other states to look at the track record in New South Wales. I'm not suggesting for a second that things can't get worse or turn into a very big problem into the future, because we know how volatile the situation is. But all I say is please look at our track record of how we've been dealing with the outbreaks, the way in which our communities responded, and please consider that before you make border decisions.
Just on that, in your mind, are there any hotspots that exist in New South Wales that the other states should figure out?
Well, the Commonwealth government, or the Chief Medical Officer at the Commonwealth, already said that there aren't any hotspots in New South Wales. So it's not even, you don't even need to take our word for it. I mean, Chief Medical Officer Mr Kelly actually declared that there were no longer any hotspots in New South Wales. And so unfortunately, that's not how other states are treating it. And that's why I feel that we do need to think hard and long about those issues.
I mean, in terms of international students, it's obviously vital for the economy. Are you going to have a renewed push on that particular realm?
Well, obviously, we would like to see that happen at some stage, but the pause for a month in the number of Australians we're welcoming back to New South Wales is a good opportunity for us to think about all those issues. I think once you have a certain proportion of the population having access to the vaccine, once we know what trends are occurring in other parts of the world, we can consider those issues. But I think it's important for us to think about all those things in the month pause that we have. We need to think about what the new strains are doing and what that means in the broader settings we've got in place in New South Wales. We also, I think, know for certain what those high-risk activities are. Unfortunately, singing, dancing, mingling with each other do spread the disease if anybody has it in a particular place. So we know what the high-risk activities are. We also know in New South Wales what we can do to still have those big milestones we celebrate, still have everybody invited that we want to invite, but have it in a COVID-safe way. And I think they're the things we need to consider moving forward. In relation to international students and also skilled migrants, I think there are issues we do need to consider during the course of the year. But obviously there's a bit of a pause on that because of the new strains of the virus. But obviously later down the track, that is something we should be looking at. But the federal government's made their views very clear. They control policy in this area. They've said their priority is welcoming back Australians who are stranded overseas. I understand that and respect that. It's not a policy the states can change. The Commonwealth needs to lead that, and the Commonwealth has made it very clear, and the Prime Minister in particular, that his priority and his government's priority is to welcome back Australians first and foremost, and I understand that. So I'll go there first and then there.
On the workplace front for the vaccine, are you attracted to the idea of penalties for employees and or others who might lie about having the vaccine?
Well, I'm proposing, and I think this would be the case, that there be data sharing, because we have through Service New South Wales the ability to actually have people have a tick on their phone if they've received the vaccine as evidence that they've got the vaccine. So I think there's a positive ways we can incentivise people to take the vaccine, and that's the path that I would like us to take, to have positive ways in which we can identify that people have the vaccine, and I would like to see an incentive approach rather than the other way.
Potentially though a legal minefield all of this. For instance, what would be the employer's legal rights to demand of their staff to have a vaccine?
Look, I think in all issues regarding a pandemic, it's easy to try and get too legalistic, but I think we have to adopt a common sense approach, and employers and organisations and hospitality venues may make certain decisions about who they have in their workplace or who they have in their venue, and that's a matter for them to an extent. I mean, these are all issues we'll be discussing in the next weeks and months, but New South Wales is certainly ready, and Minister Dominello is certainly ready to have us be in a position where we'd like the Commonwealth to share data with us, so we can at least allow our citizens to have an effective electronic proof mechanism to show that they've had the vaccine, and that will allow them certain opportunities perhaps. So we're keen to have something like that occur, and we're in discussions with the Commonwealth about those issues.
Premier, what sort of threat could you see anti-vaxxers posing to combating the pandemic in New South Wales, and what would you say to anyone who's opposed to getting it?
Well, I think the good news for Australians is that our government, our federal government, has made it very clear that vaccines won't be available in Australia until they've been through the appropriate regulatory authorities in Australia. So obviously, countries like the US and the UK, where the virus is literally out of control, they've been going through the approval methods in a very expedient way. I think people can feel confident that once the vaccine's available in Australia, they will have all the information available on the efficacy or on the effectiveness of it, and who the most vulnerable are that will have access to it initially. And I think Australians are sensible enough to make those decisions. And as I said, as soon as I'm allowed to have it, and we'll all have to be in queue, I will take it without hesitation, knowing that not only am I protecting myself, but potentially, I mean, we have to assess, obviously each vaccine will be different, but potentially also reducing the chance of passing it on.
You mentioned that 16,000 is too low. What is the number we need to hit on first?
Well, look, Dr. Chant has, you know, we'd often like to see the number 2 in front and even higher, but that's been the target, but as high as possible. We don't expect to have those really high numbers we had prior to Christmas, but we'd certainly like to see 2 in front of the number. Do you want to comment on that, Kerry?
Obviously, we want to see the testing rates as high as possible. We want to see it in symptomatic people because that's our, unless we've otherwise told you to go there for public health reasons to get a test, and that's because that gives us our highest chance of finding real cases. So we want high value testing. We look at the data which tells us across, is there an even spread? So at the moment I'm particularly interested in the testing data around those areas where we've had those unlinked cases, and obviously we've had an unlinked case in that patient that presented to Mount Druitt. So in those areas of southwestern and western Sydney, particularly interested in making sure there's no unrecognised chains of transmission. So we look at all that data and we look at it by area. Can I just say a big thank you to the Berala community and the Berala and the local government areas surrounding that. The testing rates have been really good in that area. You need to keep going, but thank you, that really gives me joy. And also the Northern Beaches community continue to come out in force, and that's really important as we haven't had any recent cases that are unexplained in that area, but we do need to be vigilant, and I just want to again thank you to the community for responding.
There have been some concerns raised today about the vaccine not having barcodes for batches, and I just wanted to ask you about your opinion on does that make it easier for health authorities to then track down whether there may have been a bad batch, or would you like to see the vaccine barcode?
Those are the matter for the regulator, but can I let you, in terms of the Pfizer vaccine, I'm not sure if it was the AstraZeneca or the Pfizer that you were referring to, probably the Pfizer. But let me, the Pfizer vaccine, if we talk about that vaccine, it's going to be very much managed very carefully because of its extreme cold chain logistics. It's stored at -70, it's going to go to a few hubs, it's going to be very tightly managed. So we will work through any aspects to make sure, but the principal will know which vaccines from which lots and which delivery batches are given to people. It's very important when we're reviewing adverse events following immunisation. But I've got all confidence in the regulator that they will not be approving any vaccines or any systems that would be unsafe. And I think the community can have confidence in the expert advice that goes into those approvals of the vaccine. And as the Premier has indicated, when it is permissible for me to have a vaccine, I too would be really willing, ready and able to put my arm up and get a vaccine.
Dr. Chan, are masks contributing to lower spread, and would there be any health arguments for getting rid of the mask mandate before vaccines are around?
We know that there's no silver bullet to preventing spread, but masks are a line of defence, particularly in those indoor settings, and particularly where you can't socially distance or where there, for instance, is challenges in being crowded at particular points when you're entering or leaving. So I do see that masks are contributing to reducing the transmission risk, but it will be a matter for us to, just framing that in context of what we think is going on in terms of the levels of community transmission and have a proportionate sense of response to it. But we will continue to encourage people to wear masks. We will also have very strong settings in our healthcare facilities and other settings that are at higher risk, including aged care, and take a very precautionary approach.
Do you see any benefits to relaxing that mandate?
As I said, there's a number of considerations. We've continued throughout the pandemic to advise strongly mask wearing, but also we continue to look at where we get the greatest benefit from mask wearing and make sure the community's advised about that.
Just in relation to these new variants, there seems to be a letter sent to Queensland Health in relation to Brisbane Chancellor Hotel, talking about concern about air conditioning and how it might spread on that level. I know we cleared this up early in the pandemic, but is there any indication that COVID or any of the variants can be spread through air conditioning?
So clearly there's certain circumstances where COVID can have an airborne component to its spread, and that's when you've got large numbers of people or we're doing things to people to generate lots of aerosols, and we often do that in health settings. So obviously when we're managing patients in a health setting, we do that in areas where we preferably do those very aerosol generating procedures in closed spaces so that don't allow air to escape, or have what's called negative pressure rooms, which actually attract things in and don't allow air to move outside. So clearly there is an issue that air movement in unique circumstances can lead to transmission events. I think that's an element. But I think it's getting ahead of ourselves in speculating about the contribution of or the attribution of how that transmission event happened in Queensland. I've got the utmost confidence that Queensland Health, and we are briefed on the investigations, are doing a thorough investigation, and I think we shouldn't jump to conclusions. But I think what's also the community should be reassured is that any learnings we have from any of the breaches across jurisdictions are shared, and that goes into our enhanced understanding of transmission risks, and then we put in preventative strategies. But we've always recognised that this is a theoretical possibility and always encouraged those areas to be well ventilated.
Premier, what do you make of the Victorian government's decision to allow chartered planes and tennis players to arrive at the Australian Open when there are so many Victorian residents still stranded in New South Wales?
Oh, look, that's a matter for them, and I'll let the Victorian Premier answer those questions.
Would you like some of those Victorian residents to be allowed to go home?
Look, I think I've made our position on borders very clear. There is nowhere in New South Wales that is currently a hotspot by anyone's definition. And, well, I should say by any medical definition, there's no hotspot in New South Wales, so I don't see why any state is precluding New South Wales residents or people in New South Wales from moving freely back home.
Premier, is there any likelihood we'll see an increase of those household gatherings that are currently capped at 5 increased in that next round next week?
Oh, look, potentially we're looking at all the restrictions now, and I think what's really important is not to look at one particular issue in isolation, because when you're asking the community to take your advice or take the health advice, we want to provide as much comprehensive response as possible. So we'd like to have a general reset rather than looking at things, but obviously, without being too specific, children under 12 pose less of a risk than anybody else in spreading the virus, so at the very least we'd be looking at that. But there are a whole range of things we're looking at. But again, it will depend on maintaining zero or low community cases, but also making sure that we increase those high rates of testing. And can I just make very clear that health obviously has less concerns if someone in an existing household who's already isolating acquires the disease on day 12 or 13, is less of a concern than having a new case come up where we can't link. So even though, in a day you might have a handful of cases, it might actually not be concerning, as opposed to having just one case which comes out of nowhere, which is of concern. So they're the kind of issues we'll be looking at, and the kind of issues that health will give us advice on. But I do want to send a strong message to the community. Firstly, one of gratitude for respecting the advice in recent weeks. Secondly, to say please get those testing rates up, and as Dr. Chan has said, the mildest of symptoms are where we really want you to come forward and get tested, because that allows health to make assessments on what the virus is doing and where we're at. And of course also that we don't want to put restrictions in place or leave anything in place a day longer than we need to, and as soon as the health experts and the government feels confident, we'll move forward in easing some of those things.
Ask your questions, please.
The health minister on a quick minute?
Sure.
Very quickly, obviously, there was a lady actually who wrote on the Manchester case that she had been up to Queen Hospital, and that they had, because she was from the Northern Beaches, left them out in the car park. One of just a number of incidents, I think, that are concerning around people from the Northern Beaches being treated like lepers. What's your response to that?
I was very disappointed with that response. It would appear that there was an error in terms of the health staff's assessment, and I've made it clear through New South Wales Health and messages to the Tweed Hospital staff that that wasn't an appropriate way to deal with that lady, and hopefully that won't happen again. Sorry, Ursula.
Nobody from the Northern Beaches, should be treated differently to anyone else, correct?
Nobody in New South Wales should be treated any differently when they go to a hospital. We have the appropriate protocols in place if there were a likely COVID case, but that particular person, who I understand may have had I won't go into medical circumstances, but that person did not warrant being left at a car park for any time at all, and I think the staff there now understand that.
We've been hearing from people who are positive for COVID-19 and they've been stuck in a hotel room for 30 days plus. How tough is that? Is there anything more we could be doing for these people?
Look, obviously the variants of concern have required extra care to make sure the virus and its variants don't leak out into the community. And certainly New South Wales Health has required that many of these positive cases, all of these positive cases, have genetic sequencing before they leave. But I know New South Wales Health is trying to move as quickly as possible. That's frustrating for some people who are in quarantine, but we are trying to care for them as very best as we can. And I think that I've had many reports from many people in quarantine who are hugely impressed with the work that is done by our frontline staff, our doctors, our nurses and our police.
It is 1 month.
Ursula, sorry.
It is 1 month tomorrow from the start of the Northern Beaches outbreak. How proud are you with the situation that we've got through now?
I'm sorry, can you say it again, Ursula?
1 month tomorrow from the start of the Northern Beaches outbreak.
I am really proud of the Northern Beaches community. They came out in numbers like we've never seen to get tested. Can I just say, I mean, the problem, the issue here is we are at war with an unseen enemy, a virus. The only thing that will empower our frontline troops, our health staff, to deal with this is if the rest of us get out and get tested if we have any symptoms at all. We must do that. And the Northern Beaches were a shining example of doing precisely that.
Minister, can we just get your thoughts on the officers that were assaulted when they were trying to enforce the mask act? What did you think of that?
If you don't have a medical reason to not wear a mask, not wearing a mask is arrogant, selfish, and actually dopey. And so I hope the full force of the law is thrown at those people. Thank you. Sorry, is that it? Yeah. Thank you. Thanks, guys.